Assalamu alaikum dear doctors, welcome a video stations. Today we are discussing the video. So first we see the video and then I will discuss what are the questions we can expect from this video station. So let's see the video. First question, what you observe in this video? So I can see a 6-year-old female child. She is sitting comfortably, smiling, and on smiling, I could see that she has lost her right side of the angle of mouth, flattening of the right side of the angle, and on blinking, she is not able to blink on the right side. So my most probable diagnosis is that lower motor neuron on the facial palsy on the right side. Okay. So next question is that what are the two questions you would like to ask on history? I would like to ask on the history first, any history of any preceding fever, any head injury or any seizure, history of pallor onset and duration, immediately it happened, it is an acute condition or it is a long means duration, and it is since how long the patient is suffering. And I also rule in a history of infection like measles or mumps or cytomegalovirus. Now, next question is that so what are the red flag in history regarding these conditions? So the red flag are the if there is a ear infection near the ear pinna, or is there any problem in the hearing, or there may be history of like symptoms of leukemia like ALL. I would like to rule out the herpes zoster oticus, Lyme disease, this also, Guillain-Barré syndrome. Now the next question that for this case, what investigation you can do? In investigation, if all the history or examination unremarkable and no other neurological sign or symptoms, no investigation actually needed. But first, I would like to check the blood pressure first of all, and then I will, if the child is difficulty to closing the eye, I refer to the ophthalmology. I'd like to do the CVC to rule out the hemoglobin levels, WBC count, platelet count, whether there is any pancytopenia or not. And I will do the herpes zoster serology and the Lyme disease serology. And if she is not improving like 1 month, then I do the MRI of the brain. If there is any bilateral facial palsy, then I consider that Lyme disease, Guillain-Barré syndrome, brainstem pathology, and I will discuss the further investigation with the consultant with special interest in neurology or tertiary pediatric neurologist. And if there is severe pain associated with varicella zoster. Now, next question is that what condition you do the MRI? Already we know that. If it is not improving, if it is idiopathic, not to rule out by 1 month or 4 weeks, then I will do the brain MRI. Next question, how you gonna treat this child? So treatment first of all non-pharmacological. So first eye hygiene is very important. So I'd like to put a eye drops to maintain the hydration, that is methyl cellulose drops. And if there is difficulty in closing the eye, provide eye patch or carbomer ointment. If vesicle, I suggest herpes simplex virus, prescribe the acyclovir is oral. Then if the patient is present within the 3 days, then I would like to give a fitness loan or milligram per kg for 10 days, then I will taper after 6 days. Or if patient present after 6 days, then I would like to treat symptomatically if it is idiopathic. If she has herpes zoster, then I would like to give acyclovir. If it is a Lyme disease, I would like to treat her with amoxicillin. Now, next question is that what is the prognosis of these conditions? So, prognosis is very good, excellent. Most of the cases recover by 2 weeks, but full recovery may take 3 to 6 months. But initial recovery is good in most of the cases if it is idiopathic. How can from this video I know that that is a lower motor neuron palsy, not upper motor neuron? Because when the child has lower motor neuron palsy, the eyes will be open. It will not be able to close. So the same thing here, the eye is open. Once she is trying to blink, that blink means she is trying to close the eyes. Left eye is closed clear in video, but the right eye is open, so it means that it is a lower motor neuron facial palsy. Upper motor neuron eye can be closed. Remember this, that upper is pair to upper. So that means lower part of the facial is involved here. So this is all about this video, and I suggest the doctors please discuss with your study partners about video stations, and of course follow the nice guidelines. Thank you very much.